everybody, for taking time to join today's special topic webinar, The Advocate Inside of You, Helpful Tools to Combat Today's Patient Challenges. My name is Carla. I'm the Director of Education at NeedyMeds. And before we kick off the presentation, I want to go over just a few points. If you have any questions, you can feel free to type them into the questions section of your GoToWebinar control panel. Just know that we will refrain from answering questions until the end. If we don't have the time to answer your specific question, please know we will follow up with you personally via email after the webinar. That may take us, though, until tomorrow. But of course, at the end of the webinar, we'll also provide our contact information for both the U.S. Pain Foundation, whose expert is conducting today's special topic webinar, as well as the contact information to NeedyMeds. Also, this webinar is being recorded, and we'll work our best to convert it as quickly as we can into a video to be available for viewing on the NeedyMeds YouTube page. And you can find an easy link to the NeedyMeds YouTube page on our homepage of our website on the top right-hand side, with a bunch of the other social media icons. And to be honest, I don't know half of what those social media icons stand for. But anyway, check us out on those social media platforms when you get a chance. And you can also download a copy of today's presentation from the handout section in your GoToWebinar control box. If you have trouble, let me know. I'd be happy to email it to you. As a matter of fact, I'm emailing it to you all anyway, as we have a follow-up email we'd like to send you personally after the webinar. I will try and get that to you today, but again, it may not happen until tomorrow morning. So that's enough of the housekeeping tips. Let's go ahead and get started with today's presentation. For those of you that are not familiar with NeedyMeds, first of all, I want to take just a quick minute to tell you who we are and what we do. NeedyMeds is a national nonprofit, and what you're looking at on our screen is our updated mission statement and a little blurb about how we go about achieving our mission. But what I really want to stress that you'll notice in that mission statement is a part of it is what we call education, or educating people. And we do that really in two ways, or I should say we define that in two ways. First of all, by letting people know about the resources NeedyMeds has and how we can help them afford their healthcare needs. But also we define education by letting them know about other resources that will help them in their health journey, which is why we are so thrilled to have an expert from the U.S. Pain Foundation here with us. It is my pleasure to introduce Shana Smith, the Director of State Advocacy and Alliance Development with the U.S. Pain Foundation. Shana joined U.S. Pain Foundation towards the end of 2018 as a pain ambassador. At the time, Shana was experiencing pain throughout her entire body without a diagnosis or treatment plan in place. Probably a situation a lot of people in our country are dealing with. Longing for compassion and understanding from others in her shoes, she learned of the incredible work and programs offered by the U.S. Pain Foundation. Finding a support system and resources from what she herself describes as a professional yet welcoming nonprofit allowed Shana to move forward in her pain journey with confidence and validation that she was not alone. And it also allowed her to move along in her career to the current position she holds, which again is the Director of State Advocacy and Alliance Development. You can see why her personal and professional lives have made her the expert that she is. And we're so pleased to have her share her expertise and tips on how to be your own advocate today. So without further ado, I'm going to try seamlessly to pass the screen to Shana. Bear with me while I find how to do that. And Shana, you should be able to take it away. Again, I'll remind everybody, if you have questions as Shana is conducting her presentation, feel free to type them into the questions section of your GoToWebinar control panel, and we'll do our best to answer them at the end of the webinar. Thanks again, and enjoy today's presentation.
Thank you so much, Carla, for that introduction. And today we're going to just be going through a bunch of different helpful tools, some tips for you as a patient, an individual perhaps with a chronic condition, or maybe you're a caregiver who has someone that has a chronic condition, just tips and tools and things that you can do to help better advocate for your health or for a loved one's health as well. So I have a few goals for today's presentation. One is to empower at least one person. It takes only one voice to make positive change, but of course, the more the merrier. If I could have a few more people that are interested in maybe at the end of this wanting to take some proactive steps, that would be incredible. The next goal is to encourage attendees to build a new or to build off of an existing health advocacy plan. We'll get into what that is in a few minutes, but know that you are your own best advocate. You may have already heard that saying, but it is absolutely true. And you'll learn to value this trait as you seek out ways to enhance it. Educate. So today I'm going to be sharing a general roadmap of what it means to advocate for your health. I'm also going to provide some hands-on interactive activities or tools for you to practice your new health advocacy skills, because I feel it doesn't hurt to run through newly learned skill sets before having to take on real-life scenarios along your pain or medical journey. And finally, I threw it in there, keep you awake. This is not a group napping session, although I'm sure most of us would love to take one right now. But in all seriousness, we do need to be ever vigilant when it does come to decisions being made by outside parties, such as insurers at the state and federal level with lawmakers, various government departments. It really is up to us to be alert and aware of how decisions from those made in the doctor's office to those made on Capitol Hill could impact our treatment plan and overall quality of life. So what does it mean to advocate for your health? I'm just going to pause here for a moment and let you all reflect on this question. This is one of our advocates for US Pain Foundation, and she's heavily involved in the migraine and headache space, Katie Golden. So advocating for your health means being proactive. If you have new symptoms, if a medication or treatment regimen that you've been using doesn't provide you with satisfactory results, take notice and take charge of your life. And speaking of taking charge, well, many of us here today have nothing but respect for those who have entered into the healthcare profession. We can still question why a treatment option is being offered, why a medication seems less effective, if there are some other options to consider, etc. Advocating for your health means you are the driver, so you're behind the wheel, and members of your health team are co-pilots. They're helping you navigate down your pain journey, and you value their expertise and support, while at the same time recognizing this is your journey. And sometimes you need to be thinking outside of the box and lending your expertise as well. Remember that no one knows your body, your mental, emotional, and physical makeup like you do. And knowing that you have options. So perhaps, let's say your insurance company's decided it no longer wants to pay for a treatment option prescribed or recommended by a doctor. What do? You can appeal an insurer's decision if you disagree with their response to your request to have a test completed or a procedure or medication covered. And you can research whether your state has protections in place to allow you to access your treatments timely. If not, maybe get involved with state advocacy initiatives or start your own effort and see to it that your state has protections in place. And don't worry, we'll be getting into ways that you can take charge and pursue those options a little bit later during today's presentation. And finally, advocating for your health means fighting for your best interests. I put this in here because I know at times it's not easy to reach the outcomes that you're striving for within your treatment plan. It can literally be a battle, but you should never settle for less than what you deserve, which is to live a life with pain and not in pain. And that's what US Pain Foundation has taught many of its pain warriors, including me. And it's truly a positive way of thinking, and it can really carry into how you perceive your pain or medical journey. So there might be times when you have to disagree with specialists, urge them to take alternative action, demand that something be handled a specific way so it doesn't cause any further complications towards your condition. It's okay to speak up and to speak out. That's why we have these vocal cords. So let's jump into in the doctor's office and ways that you can advocate there. So the appointment is mostly spent on discussion, or what we're going to call the medical interview. And that interview has three functions: to gather information, to develop and maintain therapeutic relationships, and to also communicate with one another. Now, we all know the doctor-patient relationship is going to directly determine the quality and completeness of information that's shared and understood. If you and a healthcare specialist do not trust one another, or you're unable to disclose information efficiently, then this partnership will fail. In fact, it was found in a study that patients who are active participants when they're in the doctor's office and they're asking questions actually do better biologically in quality of life, and they also have higher satisfaction. So we're going to discuss here ways you can advocate for your health as it now relates to your medical appointments. So the first way that you can begin to take charge of your health is by taking notes. Have you ever left an appointment, and I am guilty of this all the time, you leave an appointment and then you remember you forgot to ask your doctor another question, or maybe you had several other questions, or you couldn't really describe at the time how your pain was or how frequently you experienced high pain levels, new symptoms, or specific types of pains or symptoms. Well, you can help clinicians better navigate you to more successful treatment options if you're providing doctors with as much information about your health as possible. So some examples of what to disclose when you are taking notes might include activities that your pain prevents you from doing or your medical condition prevents you from doing, activities that your current treatment plan does allow you to do, anything that may have lessened your pain or your symptoms, what might have made it worse, any side effects that you're experiencing from the new medications. So taking notes refers to that, but it can also refer to jotting down information that your doctor is sharing with you at that appointment as well. Keeping records. So there are obviously a number of reasons why this is important, but believe it or not, oftentimes patients may not be keeping a file containing their test results or surgery dates, medication complications, etc., especially in this day and age when a lot of our doctors' offices are keeping those things in a paperless manner. So it is kept on file somewhere, but it's always good for you as a patient to have a record at home. So by having these resources on hand, it can assist your caregiver in an emergency situation. It can also provide a roadmap for any new members of your healthcare team or existing ones to gain a clear picture of your journey. And consider having maybe an advanced medical directive or a living will. This will help your family and you. It's also extremely helpful and a proactive form of self-advocacy. Speak up and ask questions. So under speak up, if you're experiencing a time-sensitive situation relating to your medical condition, utilize nurses and other staff within your clinician's facility. See if they can help you schedule appointments with outside specialists. If you have an upcoming appointment, but maybe you feel a little uneasy waiting for so long, you can call and ask if there are available times to be seen sooner, or request to be on a cancellation list. Again, you are in the driver's seat, so you need to always be thinking of ways that you can help yourself feel better, get answers quicker, and manage your condition more effectively. This is not being selfish. This is definitely just self-care management and a good practice for you to start doing. And for asking questions, when you're in a doctor's office, make sure you're making the most of that time by sharing any concerns that you may have about your health issues that have risen during your treatment plan, and discussing maybe alternative options that you may have learned or heard about, maybe in support groups or in doing your own research. It never hurts to ask, but it can hurt literally if you don't take proactive action in that examination room by speaking openly and honestly with your physician. Now, you can be shy outside of that room, but when you're there and you have taken the time and the energy to get up, get yourself dressed, and get yourself to that office, please, please make sure that you have made the most of it, because you deserve it. And also evaluate your care. If you've had several unpleasant encounters with those who are supposed to be on your team when it comes to pain management or management of your condition, perhaps it's time to find another doctor. Remember that before making a switch to a new physician, that you've given that doctor a fair opportunity to state his or her case as to why they may be dismissing your concerns or perhaps not taking more urgent approaches towards your health. Doing so in a non-accusatory manner will prove more positive results. If after taking the time to learn about that doctor's approach, you're still feeling uneasy, then it's probably time to find a new physician. Advocating for your health as it relates to insurance companies. So we're going to transition now into the part of your pain or medical journey where maybe you've already received the treatment option that's been recommended by your doctor. But oftentimes people with varying chronic conditions find that there are several barriers to access that necessary treatment. So here I've listed some examples of barriers, and then I'll explain how to combat those challenges. So under access barriers, I have here step therapy, non-medical switching, and prior authorization as some examples. Now, these are some of U.S. Pain Foundation's priority issues. Step therapy, for example, is when you get a prescription from your doctor and you go to the pharmacy to pick it up, and the pharmacist tells you that your insurance needs you to try another medication or several medications and fail first on those regimens before you can get the originally prescribed treatment option. Now, of course, that wastes time. And then, you're also, you don't feel like you're in control of your health. And obviously, you should be. Another access barrier is non-medical switching. Now, this is when you've been on a medication for several months or maybe even years. And then the next time you go to pick up that prescription, you see that your insurer wants to pay for a completely new alternative therapy option. This is a cost-saving measure that insurance companies or pharmacy benefit managers use, and it can be a very harmful practice for several different individuals with varying conditions. Again, it could cause disease regression. It can cause a delay in treatment, and it sometimes forces patients not even off of their medications, but maybe medication adherence altogether. So they decide that they're just going to skip taking a treatment option because perhaps the one that they wanted to take is now more expensive because their insurance placed it on a higher tier, or they've increased your out-of-pocket costs. Now, denials, I put that in there. That's when an insurance company opts not to cover any medically necessary procedures or treatment options. So there is action that you can take if your health plan won't pay for your treatments, or if your carrier delays your care, or if you've experienced any of those access barriers that I just listed. There are state and federal laws in place that may protect you from those harmful practices mentioned moments ago. And we'll get into that more when we look into advocating at the legislative levels. So here, let's look at 3 key ways you can champion for better care of your health. Number 1, you can appeal the decision that's made by your insurance company. You always have the right to an internal appeal. Again, always have the right to an appeal. You can ask your insurer to conduct a full and fair review of its decision, and here's how. So first, you're going to collect any letters that your insurer has sent to you. So those are the letters that notes why they've denied your claim. They come in the mail, and they're usually pretty clever about why they've decided to not cover a certain medication, or why they've decided to go another route and maybe have you do another procedure instead. So then you're going to, after you collect those letters, call your healthcare provider's office, because they do have people on staff who usually help with that appeals process. They can advise you on how to fill out the appeals form. They can write appeals letters for you, or even write the letter on your behalf. I will tell you, as incredible as my son's pediatrician is, their office actually stated that it's the patient's family who typically will send out the appeal, and then his office will get involved if need be. So depending on your doctor's office and practice and how much staff they have on hand, you might need to write that letter for yourself. But again, advocate for your health and ask if there's a staff member on hand who can help you through that process. So we ended up writing our letters on our own. I actually had to write one for my son, and I had to write one for me. Then you're going to submit the appeals request. Now, expect to wait anywhere from 30 days to hear back from the insurer, or even 60 days. And you'll wait 60 days if you've already received that treatment and now you're waiting to be reimbursed. Make sure that you're following up with your insurer until you hear back. Keep a record of the date, time, and different representatives that you've spoken with. You can also request an external review. So let's say your insurer denied your coverage on appeal. Under law, you are entitled to make that appeal to a third party for an external review. So that means that your insurer does not get the final say over whether to approve a treatment or to pay for a claim. Now keep in mind, you can skip the appeals process and go right to the external review if you find yourself in an urgent health-related situation. For example, if waiting 30 to 60 days would jeopardize your ability to regain function or your life. Now, by going down this route, your insurance commissioner or attorney general assigns someone to research, investigate, and then resolve your complaint. And then that person examines your records, and they might even question witnesses and hold a hearing. Now, if your insurance commissioner or AG finds your insurer did violate laws or regulations, they may order your insurer to cover your requested treatments or to compensate you. And then you can file a complaint. So you always file a complaint. You always have that right by, for example, visiting maybe one of our allied organizations' website. So we put up here an example of a place that you can go. AIMED Alliance has put out this online tool. It's called coveragerights.org. You can file a complaint, especially if you still experience problems after the external review. And the complaint should include everyone that's involved in your case. Make sure you include the policy number and dates of denial and the reason for the complaint, and also what you would consider to be a fair resolution. Finally, let's discuss some ways you can advocate for your rights at the state capitol and also on the Hill in DC. Number one is to get involved. So in order to learn as to whether or not your state has patient protections against insurance barriers we discussed, or any other issues that you may have encountered during your medical or pain journey, visit our website and you can find out by searching by state or by issue. Now, if your state does not have strong enough protections, or any protections for that matter, relating to patients receiving medications timely, or perhaps you want to see a complementary therapy specialist, but they don't get reimbursed by insurance, get on the phone or send an email to your state representative. Request a meeting to discuss some ways that your state can strengthen its protection laws for you. And US Pain also has the ability to help you through that process. And we can even provide your state representative with model legislation if it's out there to consider implementing within your community. You can also join Hill Days, which are advocacy events that take place either in DC or right at your state capitol. And that's where patient advocates will schedule meetings with their congressmen and women or their state reps and senators, urging that they support proposed bills or consider sponsoring a bill that you would like to see filed at the federal level. Another way that you can advocate is by testifying. So going before a state committee is another great way to express your support or even opposition to a bill that may impact your quality of life or patient safety. And by tracking bills in your state, again, you can pick and choose which ones you would like to become involved with. Submitting letters to lawmakers and also sending emails is another great way you can testify if you, for example, maybe can't be there in person. So you can submit a letter to the entire committee, and most of your state.gov websites will make you aware of how to submit public testimony. And you can also follow those similar steps at the federal level. I put in there submitting op-eds or letters to the editors because you can really increase your outreach by submitting an opinion piece or a letter to the editor on a bill or an issue that you would like to see resolved or passed. Maybe there's a bill that would greatly hinder your ability to maintain your quality of life. Consider writing your opinion on that. Explain in your article, as well as when you testify, about your pain or medical journey and how this legislation would impact your treatment plan. Lastly, another way is to consider becoming a patient advocate. Of course, I'm a little biased when I say you can advocate for US Pain Foundation, but there are so many different nonprofit organizations out there that you will find, and do your research and find one that you feel will share the same philosophies as you when it comes to your patient rights. I'll just explain briefly becoming a patient advocate for US Pain Foundation and what that's like. So the process is very simple. You go onto our website, look at ways that you can become involved. We have an ambassador program, which seeks to raise awareness and education within your community by maybe handing out different materials or setting up a booth, holding little educational workshops. And becoming an advocate goes that one step further, where you're really taking a more hands-on grassroots approach, and you're getting out there and you're testifying, submitting letters. Maybe you're active on social media and you're tagging your state representatives, making them aware as to why they should support or oppose a bill. So you go on the website, apply to become an advocate, and then what we do on our end is we have a state and federal directors, and we'll send out e-alerts depending on what the issue is by state, for example, and we will let you know of a bill that we are tracking, why we're tracking it, if U.S. Pain Foundation supports or opposes that bill and why. We'll explain a little bit about the bill, and then we will provide you with ways that you can take action. So a lot of our e-alerts, the majority of them actually, will always have contact information for key legislators. So that means email addresses as well as phone numbers to their offices. We also provide in that e-alert template letters or scripts for you to consider using when you want to reach out to your legislators, just to make that process a little bit easier. And you know, we always tell our advocates, feel free to share your own personal journey or why this might impact you and why. Again, that we just provide the script as a platform, as a foundation or base for you to get started. And then other times we will send e-alerts that also request that our advocates go and testify or participate in advocacy events at their state capitol. Now, in those circumstances, don't be nervous, because we also will do whatever it is that we can to make that process a simple one. If you need help signing up to testify that morning, we can help you with that. If you would like us to look at your testimony ahead of time or even help you craft your testimony, we can do that. If you're not too familiar with an issue, or you are familiar but you want to make sure that you have all your facts right, we can schedule a phone call with you and walk you through that process and come up with some additional materials that might help you create your testimony. U.S. Pain's advocacy section has a lot of resources. You'll find our position statements on our key issues that we're tracking during this legislative session, for example, as well as some samples of ways that we have taken action. So letters to the editor for one example. So really get familiar with either that platform or another nonprofit organization and consider advocating with them today. Now, advocacy work is personal. For many of us, that is true. We fight for ourselves and/or we fight for our loved ones. So I wanted to take a moment here and explain a bit about my son, Landon, and me, so that you hopefully find today's information credible, and to also provide you with proof as to how you can make a difference despite your invisible disease. So this is my son, Landon. He is almost 8 years old in May. And then all the way to the right is my husband, Tim, who is actually a caregiver for Landon and myself. Now, I was diagnosed with Ehlers-Danlos syndrome, hypermobility type, in 2015, which was 5 years after the true onset of my chronic pain. We weren't new to this genetic connective tissue disorder. In fact, I married into a family of EDS gurus. My mother-in-law also has EDS, and she's been instrumental in providing us with information relating to this condition. And through years of conversations with the in-laws, we learned that even though EDS type 3 is considered the least severe, it can still involve some significant complications. We also learned there was a 50% chance of passing that condition down to our children. However, we had our son Landon before I even knew I had EDS, and that's not to even say we would have opted to not have a family, but maybe we would have been a little bit more mentally or emotionally prepared for the health-related challenges that have come our way. I'll talk a little bit about Landon. For much of his young life, he showed absolutely no signs of discomfort or medical complications. He was crawling before 6 months of age, walking before 10 months old, full of energy, imagination, and compassion. And then as he began to age, we did start to notice hypermobility in his joints. But because children can be flexible, we weren't really overly concerned with his ability to move his joints beyond the normal range of motion. And then a little over a year and a half ago, Landon began to complain about aches in his neck, his shoulder, and his lower back. So since the start of Landon's journey, our family has had to make some minor adjustments because we were told it was possible Landon also had EDS. We followed different recommendations from his healthcare team, from taking specific vitamins each day to sleeping on a memory foam topper to prevent subluxations, which are mini dislocations. We also felt it important for us to reach out to family and Landon's school to join his health-related support network. So for example, when he entered first grade, we notified the administration that classroom accommodations may be necessary and that we might breach the dress code when it comes to footwear, and that frequent absences could be expected. This year, now that Landon's in a public school system, we did work and got approved a 504 plan so that he can continue flourishing in his school. So these acts are all examples of advocacy. I'm taking charge of my health, and in this case, I'm also taking my son's health. I'm taking charge of his health as well, because everyone deserves to have the best quality of life possible despite their conditions. Now, I live with pain daily, but I don't let it define me. In fact, it actually surges my passion to speak up on behalf of others living with invisible illnesses. On days when my pain is heightened, I can still advocate on my laptop or on my cell phone by emailing legislators, urging them to support or oppose a bill. If I'm maybe lacking the energy to fly out to another state and give testimony, I'm not ashamed at this point or embarrassed to even ask if there's a teleconference option available. In fact, just 2 days ago, I was called by the Senate Health and Long-Term Care Committee in Washington, and I was able to read my testimony in the comfort of my home. So remember that you can make a difference no matter your disease. I had a dear friend who has since passed away. She was a volunteer for US Pain, and she was diagnosed with stage 4 cancer. And she was still providing advice for other advocates and was submitting letters from her bed until she was no longer able to do so. So US Pain and other organizations do make sure that people from all walks of life can participate in advocacy efforts. And for me, I advocate so my son has a better future with less barriers to access in order to access the care and the treatments that he needs. And I truly hope that those listening today understand that they too deserve those same basic patient rights. So I will pause for a moment now. I know that Carla has been fielding the questions, and to see if any of you had questions or comments to make regarding today's presentation.
Shayna, not surprising, this presentation was not only informative, but very empowering. I think, as I had said in the introduction, that I think your unique position with the U.S. Pain Foundation and experience professionally, but also personally, makes you the unique expert that you are. And I have no doubt that our audience today can see why we were so eager to have you speak.
Oh, thank
So
you
I
so
want to
much.
thank you for that. And thank you for breaking down in bite sizes what we all, as lay people, myself included, the topic of advocating for yourself, and certainly advocating beyond yourself for others in your community or family, can seem a bit daunting. So the fact that you took it down into these smaller chunks and make it palatable and something that I could easily digest and say, these are things that I can chip away at a little bit at a time. So thank you for that. And thank you certainly for sharing your family story, because it absolutely drives home that, as you said, that of quite a few points that you make, that you need to support yourself with people that are part of your care team. Advocating for yourself and others is really important and really can start at home. And ultimately, it can make a difference in myriad ways in your own personal life. We have a couple of questions and certainly comments coming in. Let's get to this one. In the beginning, you had talked about some of the obstacles or barriers. You mentioned step therapy. What were the other two that you mentioned, and can you briefly define what they are again?
Oh, sure. So the other two were non-medical switching and prior authorization. So non-medical switching is when you've already been on a prescription for a while, whether that be a few months or even years, and then you're forced off of that medication because your insurance wants to save money, basically. So the way that they do that is they can actually completely put you on an alternative medication, not a generic substitution, but a completely alternative therapy option. They can force you off of your medication by increasing your high out-of-pocket costs, and they can also force you off of your medications by placing your treatment therapy on a higher cost tier. We call it restrictive or specialty tier. So basically, the insurers are making it financially inaccessible for you to remain on the medication that you have been taking successfully. And then prior authorization is when you need to wait to hear from your insurance company as to whether or not they will cover either a medication and or procedure, which of course causes delay to your treatment. And so what we try to do with all three of those access issues is we try and promote and support legislation that will allow patients to receive the medications they need, the appropriate ones that they deserve, in a timely manner.
Fantastic. Thank you so much for, again, breaking it down for us.
You're welcome.
I'm getting a lot of feedback. Our audience is really enjoying the presentation and mirroring my sentiment, which is that it's very empowering. Some of the other questions coming in, and here's an interesting one. I'll bring it to you, Shana, the way it was worded from our audience member. Whether or not a representative at U.S. Pain has taken the lead on a workers' compensation side of things.
Yes. In fact, what we have done over the years, so I'll use step therapy as an example. Step therapy laws have been put in place in a number of states. And sometimes the bills that are passed don't include workers' compensation. So then what we try to do is go back that following year and request an amendment and see if the same bill sponsor will offer up an amendment to an existing law to include protections for those individuals who are under workers' compensation.
Great. And this audience member in particular, and I don't want to read too much into it, but may be interested in offering some of her expertise as well. So in that case, what I would suggest, and tell me if I'm wrong, Shana, you can certainly shoot Shana an email, but at the end of our presentation, we'll also have the contact information for U.S. Pain in general, and in the follow-up email, you will find additional contact information as well. Does that sound about right?
Absolutely.
Great. Another question from an audience member who I will pass along. Thanks you for your presentation. Should anyone who has chronic pain that has an active care plan, let me read this. Anyone who has, let me see, I'm coming in the middle here. Okay. Is it a fair statement to say that anyone who has chronic pain should have an active care plan with an MD and pain management specialist that the patient should understand and be aware of? So if you're experiencing chronic pain, should you have an MD/pain management specialist? Is that one of the basic things you should do?
Yes. However, there are certain, not everyone will go the route of a pain management specialist. For example, the disease that I have, it doesn't really respond well to medications. And in certain circumstances, a lot of pain management specialists, what they will do is they will try and work with you to find the right combination of medication therapies that work for you. So you'll really have to take into account what your disease state is and then determine if a pain specialist can help you. And one thing that I always do, and I probably should have mentioned this, is when you're looking to add on to your healthcare team to create the best plan possible for yourself, do some research online and see what they specialize in. For example, I made sure that the geneticists that my son and I see specialize in not only connective tissue disorders, but with pediatrics and with Ehlers-Danlos syndrome. So the same thing with a pain management specialist. You can go online, usually their profiles are made available, even on the website maybe of the hospital that they're affiliated with, and see if maybe one of your conditions is listed as one of their areas of expertise. And if not, go ahead and give them a call and ask who they would recommend if not.
Very helpful. And I will remind everyone that in the follow-up email that you will receive from me tomorrow morning, I will, thanks to Shana, be able to include a link to some more helpful information about how to appeal should you go down that road. Also, the link to the advocacy section of the U.S. Pain Foundation website, as well as a copy of today's PowerPoint presentation that Shana so generously put together. We have another question coming in, and I think that this is actually great and a great transition to allow me to speak about NeedyMeds, but I'm going to let you feel this one first. Let's say there's a patient who's given a healthcare plan that they can't afford, such as multiple visits or tests. I know that I can certainly chime in and talk to you about NeedyMeds and other resources, but Shana, I'm sure that's a question you've gotten before, and whether or not you have suggestions about that.
Sure. So I definitely think that resources such as NeedyMeds is a great place to start because they have years of experience in how to offer some alternative options for those who are unable to either afford their medications, or maybe the plan that they selected has a high deductible. So I definitely will probably forward that question to you.
Yeah, absolutely. And that's a tricky one and an important one. So I'd be happy if you want to go ahead and switch the screen back to me.
Absolutely.
What I can do is just take the time to hopefully shed some light on how NeedyMeds can help you afford your healthcare needs. I went ahead and put up a slide of our mission statement and how we achieve it. But essentially, in plain language, we are a national nonprofit. And what we do is, our goal is somebody gives us a call or visits our website because they have trouble affording their healthcare needs. The reason I say healthcare needs is because oftentimes that we're not only talking about medications, we're talking about access, transportation expenses to a doctor or specialized facility, assistive technology like a wheelchair, testing supplies like syringes for diabetics. So we're talking about really being able to afford any healthcare need. And Shana talked a lot about barriers to getting yourself healthy. And I would say, and I'm sure Shana and the audience would all mirror this sentiment, which is that a large barrier is being able to afford what you're being suggested to do by your healthcare team. So
Yep.
there are ways to hopefully bridge that gap. And one of the things I would absolutely urge you to do is get in touch with NeedyMeds, and you can do that. Just bear with me, because what I want to do is bring up our website. What you can do is visit our website, check out the patient savings tab. Now, the great thing about NeedyMeds is we have so many resources to offer. The bad thing about NeedyMeds is that it can be a little bit overwhelming. So certainly when you come to our website, and I'm trying to get that patient savings tab to pop up, under that patient savings tab, you can look for help affording your medication and healthcare needs. But you can also simply call one of our expert counselors at 1-800-503-6897. We're in Massachusetts, so we're on Eastern Time. We're available Monday through Friday, 9 to 5. I would say if you're uncomfortable or overwhelmed by the website, or if you have somebody that doesn't have the luxury of having access to the internet at home, or you or your loved ones would prefer to speak with a Spanish-speaking counselor, we have those available. So I would say visit the website or give us a call and tell us the medication or the medical need you're looking to get help affording, or you can simply tell us the name of your diagnosis, and we can see what costs are available, what programs are available to help those costs. That's our first goal. If we don't succeed with trying to find you a program that will help you, we can forward you on to another partner organization, such as RX Outreach, which is hopefully a name everybody will become familiar with. They're a wonderful organization. They're a nonprofit pharmacy. Let's say it's medication that you're having difficulty affording, and your insurer won't cover it or you don't have drug coverage. And then you call NeedyMeds and we don't have a program. And then you call RX Outreach and they don't have the drug. At the end of the day, we do have a safety net called the NeedyMeds Drug Discount Card, which you can use to also save money on your prescription medications. So we hopefully have you covered in a number of ways. So I would say reach out to NeedyMeds with any health cost barriers you're facing, and we absolutely will do our best to connect you to a program that exists. So, and I'll be very candid. Will we always be able to help? We will not, but it's free, it's anonymous, and it'll take a minute out of your day. So please don't hesitate to give us a call. With that, I'm going to bear with me. I do see some other questions coming in, but we are running out of time. So know that we will respond to those questions tomorrow morning at the latest. In the meantime, I wanted to take a moment. Oh, got that wrong. I wanted to put up some, just a snapshot of some of our other upcoming special topic webinars through the end of this month, and you can join up for any you're interested in, of course, for free. On the homepage of the NeedyMeds website, on the bottom right-hand side is a calendar of events. As I said, you can expect a follow-up email from me tomorrow morning, and we will respond to those questions we didn't get the chance to today. Again, either myself or Shayna, if it's appropriate, again by tomorrow morning. If those questions you feel are more pressing, you can certainly reach out to the U.S. Pain Foundation at that contact information on that slide. And if they are questions about how to afford your healthcare needs, don't hesitate to visit NeedyMeds or give our expert call centers our expert call center counselors a call at 1-800-503-6897. With that, of course, I want to extend our deepest thanks to our expert Shayna for taking time out of her day to share her expertise with us, and absolutely a thank you to our audience for allowing us to share our resources with you, which we do hope you found helpful. Here's wishing everybody a healthy, happy, and comfortable rest of the day. Everybody take care of yourselves, and Shayna, thanks again. Bye-bye.